Having a Human Rights Commission has found that the KwaZulu-Natal Department of Health violated the rights of oncology patients when it failed to provide relevant services in the province's two major hospitals. In a statement released last week, the Commission said it received a written complaint raising a number of challenges regarding the provision of healthcare services to oncology patients in the province. The complainant alleged that there were insufficient radiotherapy treatment devices and facilities in the province of KwaZulu-Natal, which in turn had a negative impact on the treatment of patients living with cancer in the province. Now we are joined in studio by the CEO of the Human Rights Commission, Tseliso Thipanyane. Very good morning to you, sir.
Good morning to you, sir.
This report, if you can give us a quick overview, how you view the report.
Yeah, thank you. You know, in terms of Section 27 of our Constitution, the government has a duty to ensure that, we all have healthcare service in our country. And the Constitution provides that the government must, within reasonable resources, take necessary measures to make sure that this right is realized.
Yeah.
So what we found in KZN following the complaint is that, the Department of Health there in the province basically failed the cancer patients by not making sure that we have enough equipment to address issues of cancer. We also don't have enough doctors. As you heard last week, I think almost all the oncologists in public hospitals in Durban quit because, of the poor conditions there. So this is definitely a violation of Section 27. And we as a commission with a mandate, to ensure that human rights are adhered to, and also a mandate to find appropriate redress where human rights have been violated. We have then put to the department that, this is a violation, and the department must take necessary measures to ensure that these issues are concerned. And that's where we are today. And I need to say, this is actually quite sad because a lot of patients in the country and in the province are not really getting proper service.
Yeah.
Because of these challenges, many patients in KZN take a long time before they could actually get treatment. And as we have seen in your previous clips, in the previous clips, cancer medicine is also very expensive and very high.
I'll get to the cancer medicine, but I want to talk about this crisis quickly and finish it off before we move on to the price fixing amongst cancer medication, which I'm sure you're concerned about. But when we deal with this crisis, lives are at risk here. People are actually putting their lives of their family members and so forth at risk because of this. The way forward in the short term, what do you want to see happen as the SAHRC?
Well, we're giving government 10 days to respond to our finding and also indicate how they're going to respond to these two main challenges. One being lack of doctors, two, making sure that the cancer equipment works. And, we are hoping they will respond and give a satisfactory answer as to how they're going to address this problem. And if they don't, then, we'll have to take further measures.
What are those measures and what has been the first, what's been the sort of first engagements with the department? What has it been like?
Well, when we receive a complaint from any member of the public, making allegations that human rights have been violated, we then communicate with the parties deemed to be responsible for such violation, the respondents. We give them a chance to get back to us and indicate, give their side of the story. Yeah. And then we make an assessment, on the basis of the two sets of evidence to see exactly what the issue is. That's our mandate. Yeah. And then, of course, we came to that conclusion that, in view of the evidence before us, the department is indeed guilty of violating the rights by not taking reasonable measures, to ensure that we have doctors and we have necessary equipment. And therefore, we're giving them 10 days to respond as to how they're going to correct that. And if they don't, of course, then we can go to court, and the court can make a ruling that, the department is indeed guilty of violating the Constitution, including the MEC and maybe even the Premier of the province.
That's very, very interesting. I'm sure we're going to see what happens in due course then. But let's talk about the point that you mentioned. I think it's something that concerns our viewers. It's something that concerns South African in general. Is the price fixing and collusion around the cost of cancer medication, specifically that we've seen that's now before the Competition Commission.
Yeah. Well, again, it's also about the Section 27 rights. Right of access to healthcare services. So if the medicines or the drugs are prohibitive, then that on its own, makes this right not to be realized. And the Constitution then requires the government to take necessary measures to ensure that medicine is affordable so that people can then enjoy that right. And if government has not taken those steps, then intervention has to be made. So we are glad that the Competition Commission is looking to this matter. But the matter could also have come to us. So basically, we are looking at this process to see exactly how it pans out, because it is a violation. We are told the drugs cost more than $500,000, which means thousands of South Africans in this country are dying. The
vast majority
are dying because they cannot afford treatment. And the issue is government has a responsibility to ensure this. I was saying to someone that if we can regulate the cost of petrol, why can't we regulate appropriately the cost of drugs in this country?
I want to widen it to other drugs, because we've been running a poll and asking our viewers, do they think that more regulation and more regulation and oversight is needed? And the overwhelming majority of people are saying, yes, we need more oversight. We need more regulation with regards to it. You agree with this. How do we go down this road? How do we get there? Is part of it an outlook that you share?
Well, it's not just a matter that is an outlook I share. It's in the Constitution. The government, in terms of Section 7, has a duty to ensure that human rights in this country are promoted, are protected, and fulfilled. So if we don't regulate the price of medicines, we are therefore undermining the right to health care service in this country. That if you can't afford medicines, you can't afford health care. And therefore, government must explain. And government has a responsibility to regulate.
Yeah, it's a fundamental basic human right in the end. It is. Then we see, like in these reports that we're reading about the kind of collusion, we see things like 4,000% increases on cancer medications and so forth. Your view on that kind of corporate gangsterism?
Well, government must investigate and must deal with those who are responsible. And I guess that's why the Competition Commission has, taken a very commendable step to look into this. But as I'm saying, we as a Human Rights Commission will be keeping an eye, because at the end of the day, there is no debate about it. Yeah. Prohibitive cost of medicines is a violation of the right of healthcare service in this country.
What advice, as the SAHRC, as the CEO of this body, what advice do you give to the public who at times feel a little bit powerless when they're dealing with these massive corporates who are playing ball with people's lives?
Well, the answer is very simple. Today is actually quite exciting. Before I came, we had the Public Protector. We're also talking about the Competition Commission, and we have the Human Rights Commission. These institutions have been established by the people of this country to ensure that we not only strengthen democracy, but we also protect and promote their rights. So let us make use of these institutions and make sure they're effective in the work they do, and support them. And of course, if they step out of line, put them back in line. And I think, with what we have seen so far, we can work. That's why we've made a finding against the KwaZulu-Natal government as far as the rights of cancer patients are concerned.
So I thank you very much for coming in today. It's certainly heartening to see that you're taking this active approach with regards to the basic human rights of South African citizens. Thank you for being with us. The CEO of the Human Rights Commission, Tseliso Thipanyane, says to us today, if you have no joy anywhere else and your rights are being violated, go to the Human Rights Commission. Send that email, send that letter to the Human Rights Commission and complain. That's why we have these wonderful institutions that represent us, the people. Thank you, sir.
Thank you.